If you are new to the Charlène Gisèle show, a warm welcome. And if you are already one of our loyal listeners, I just want to take a moment to say thank you. And if you are enjoying the show, I would be so grateful if you could make sure that you give us a follow and you subscribe to the show. And if there is an episode in particular that has been really inspiring and enlightening, please do give us a review. It makes a huge difference and helps us grow the show and have the best conversations possible. On that note, I am so excited to introduce you to today's guest. I have had an amazing conversation with Dr. John Kim, who is the founder of Kim Wellness. Dr. Kim is a dedicated functional medicine pharmacist who helps others uncover the root causes of their health challenges. After earning his doctorate in pharmacy from Rutgers University, he specialized in anti aging and regenerative medicine, inspired by his own health struggles back in 2015. It is quite a moving story that is also very inspiring. As the founder of Kim Wellness, a virtual tele wellness practice, Dr. Kim focuses on hormone balance, immune health, and gut function. Today, we'll uncover how our modern lifestyle toxins contribute to chronic illness. We will explore functional medicine's role in identifying root causes like mitochondrial and microbiome imbalances, and we will learn practical detox strategy to enhance your well-being. Dr. John Kim, welcome to the Charlène Gisèle show. I'm delighted to have you with me today.
Charlene, thank you so much. It's an honor to be here in your podcast.
Oh, thank you. I would like for us to start exploring functional medicine. Can you tell us more about what that means and what it is and what introduced you to that field?
I think the field of holistic medicine has many definitions these days, and talking about general wellness as general aspect in terms of, and then even the definition of wellness can be broad term because I went to a recent wellness or holistic event and it was just talking about mental health. So let's just define what functional medicine is here. So functional medicine deals with analyzing the root cause of the disease itself and then really diving into how to reverse a problematic health condition in a broad spectrum of the root cause analysis. Could be cell membrane problem, mitochondrial dysfunction, microbiome issues, the environment, as well as the nervous system dysfunction. So I talked about five things, but the way that I help patients as a functional medicine provider, I look at the four core things, and I always look at not as a singular approach, but looking at a four ways of looking at the approach of health, and looking at just like that nervous system dysfunction, the environment, the microbiome changes that occurs, and then as well as cell membrane, because cell membrane, the health of your cells really determines the health and the function of your body. So when we're not focused on the cells and just looking at the environment or just looking at one side of the microbiome, especially if you're just going to be fixing the gut, you can't just look at the gut microbiome. You also have to look at the vagus nerve. You have to look at how the clean the environment is, as well as how's that person's mitochondria and cells functioning to get to
Mm.
the overall root of it. So that is what a functional medicine is. Um, Unfortunately, this is a problem that we could probably end up having to dive in a little more. The functional medicine end up having to turn into how many supplements we could give out to people and vitamins, and it's just end up having to be another well packaged conventional medicine turned into a quote unquote holistic. So I like to look at more the root cause medicine itself these days.
Mhm. Thank you for sharing that. On that note, I was wondering if you could share how your personal journey with health has shaped your passion and motivation to do what you do.
So I know we shared a short period of time before we started the podcast. So I had a heart attack at an age of 33 years old. I'm 43 today. I turned 43 as actually September 10th, so it's very recent. And that was a complete surprise for me. Who would have thought a 33-year-old who's healthy, who had a very much a perfect cholesterol level, uh, entire blood panel was perfect 6 months before, normal EKG level, having to have a 85% blockage in my left anterior descending artery, or aka the widowmaker, and having to put a stent put in at the age of 33. Even the cardiologists, even the ER doctors could have never thought about that. But the most blessing is that I was able to experience it. And the reason that I say it's a blessing is that when you go through a hard time and challenges, you either take it as a learning experience and getting out of that powerfully and grow, or you end up having to be a victim and then having to completely crumble down. And the fortunate thing is that I was able to see that as a recognition that there is a bigger issue within my health rather than just dealing with a heart problem. So that led me to dive in, asking a lot of questions. And as I was working with my functional medicine provider that I knew for a long period of time, having to ask questions, is there certain toxicity getting involved? Or is there certain illnesses or infections that actually is hidden that could be potentially causing it? So after about 2 months after a heart attack and doing additional blood tests and looking at this, I found that I had a positive test for Bartonella infection, which is aka the cat scratch fever, but can be transmitted through tick bite. I was in Boy Scouts all my life, so that's probably the potential ways that I got it. Mycoplasma pneumonia, which is another tick-borne illness. It can cause upper respiratory infections as well. High levels of Epstein-Barr, IgM, IgG, along with high positive rate of mold antibodies in the body. And I had high levels of heavy metals as well.
And
So
you didn't
those,
know any of this.
I didn't know any of this occurring. I thought I was just having a perfect health, but there were signs and issues that I had problems, right? And we, as a practitioners, we completely forget to really realize what kind of health change that we're already dealing with. I'll give you a perfect example. When I was in my early 20s, and then I was dealing with severe cystic acne. I never dealt with acne at all when I was a teenager, but starting when I was in my 20s and then up to when I had a heart attack, I had severe acne issues, right, cystic acne especially, as well as gut being inflamed. And so I had multiple food allergies to a point that I couldn't eat red meat that well, right? Even rice was actually bothering me. I had horrible bad breath. Bowel issue was a problem, followed by insomnia, anxiety issues. Right? Those are all signs of toxicity I mentioned before, but I was completely ignoring it because I thought just taking supplements and then knowing, quote unquote, I know, wouldn't have to fix it. Didn't do anything except for after having a heart attack and after having that aha moment that able to soon realize that there's a deeper toxicity and microbiome issues and cell membrane damages, along with nervous system dysfunction that led to what I was dealing with. So that really became a focal point for me to shift, change, and learn about myself, learn about what the disease state is. And so my main practice these days is to help patients dealing with biotoxin issues in treating and helping them to navigate through mold toxicity, mast cell activation problems, gut issues, as well as multiple other autoimmune conditions they might be dealing with.
Did you have any sense that you were in an environment that had mold exposure in your 30s before the heart attack?
Yeah, my parents had a basement that was flooded constantly, and we saw black mold that's covering on the side of the wall. My parents used to just bleach it. We didn't think too much about it, right? We Unless you really know that that's an issue, I bet you all other people out there end up having to bleach their wall and try to clean out the mildew or the black mold, whatever they try to do. I did a presentation on mold toxicity last year in London at the Health and Optimization Summit, and I was looking at the statistics of mold issues in London in itself. 900,000 households have category 1 toxicity issues related to mold toxicity. 900,000 households. How much of that is causing the health crisis that you're dealing with in UK? Probably multiples. especially cardiovascular issues, neurological disorders, autoimmune disorders, and such. And then on top of the fact that in UK, you're not constantly getting the right sun exposure that you need, right? Lack of sun exposure causes mitochondrial dysfunction, right? So these are things that are really impacting. And then when you're looking at the US data, 40% of the population end up having to deal with asthma, allergy issues.
Mm-hmm.
That's all stemming from the environment, right? So these things needs to be really looked at. Mold toxicity is so bad to a point that in the biblical times, if you look at the book of Leviticus, God tells the Israelites to burn the house down if they see mildew or mold growing. That's how horrible it is. And a second point that I also like to make to my clients is the reason that you're constantly getting sick because of mold is because mold causes immunosuppression. So there's a particular drug called mycophenolate. It comes with 250 milligrams or 500 milligrams is taken to help with and help with the organ transplant patients. So it's an anti-rejection drug that's been designed from mycophenolic acid from a mold toxin. Statin drugs are also mold toxins. Statins are coming from molvanic acid from red yeast rice. That is a yeast, a mold toxin utilized to suppress cholesterol production. Right? So there's multiple drugs out there that are stemming from mold toxins, and we're giving to the general population. Does statins fix cardiovascular issues or reversing atherosclerotic plaque? No, it has shown that actually can cause secondary heart attack from taking statins as well. Right? Statins end up having to cause mitochondrial dysfunction. Why? It's a mold toxin. It depletes CoQ10. It disrupts the complex 1, 2, and 3 within the mitochondrial complex. And then on top of causing vitamin K reduction, why? It disrupts the microbiome in the gut. You need microbiome to produce vitamin K too. But when you are affecting that because of mold toxins, that gets also depleted. Right? So drugs are designed from these type of toxins, but we don't recognize that these drugs end up having to cause more bodily harm when you're using it long term, except for the fact that these are being given to a lot of people within the population.
Mm. And if somebody is listening to this and getting really concerned about their mold exposure, is there a simple way to test your environment, test yourself to get an understanding of mold? Because I think when we think mold, we often think about that black wall in the basement, as you've mentioned, right?
Yeah.
That's kind of the obvious example. But what about the mold that we don't see or we don't think about? Can we test that? Can we get a sense for whether or not we live around mold?
Yeah. So mold is not a bad thing. Mold is everywhere outside, right? So if you walk in a park, for instance, or going for a hike and you see that the leaves are degrading and then going into the soil, mold is there to help recirculate that carbon matters back into the soil. And it's a natural process that you need the mold to help us. The issue is that when you're dealing with indoor mold, that's toxic. Mold has to survive. So what does that do when it enters in our body? It starts to break down the mucus membrane, as well as affecting the gut microbiome, and as well as suppressing the immune system. So this way it's undetected and able to thrive. That's their role, to survive. So how do we look at these things? Well, mold not only comes from the environment I mentioned before, but also comes from food, right? Certain things like corn, certain grains like rice, right? Those can be, and including coffee beans, can be
Mm.
laced with mycotoxins. So when you are thinking about cooking rice or using certain grains, one, you got to have to test that these are organic, and then make sure you wash these grains very well. What I like to tell patients that if you could avoid it, don't eat it, don't eat any grains, or at least to minimize maybe once a week or maybe twice a month. That's what I would recommend doing. Like I don't really generally eat rice, even though I'm Korean, right? So, because rice can be laced with arsenic and then certainly mold toxins. And if I do end up having to cook rice, I would soak it for about 4 to 6 hours, rinse it very, very well, and then cook the rice. So those are things that you could easily do. Certain things like moldy cheese, right? Blue cheese, for instance, right? And then how do you make that? You inject penicillium into the cheese to allow these mold to grow. Those can be very bad for your gut. I know the whole French paradox in terms of why the cheese are so powerful to help protect the cardiovascular, as well as helping to give the natural occurring vitamin K2 from cheese. That's fine, but eating blue cheese or any type of these moldy cheese, it's not very good for your health. I don't particularly agree with that at all. I would recommend patients to get rid of those as best as you can. And then, as well as your over environment, you want to check your air quality samples. If you could buy a good HEPA filter, that's a good part. Make sure your entire house is very well aerated. If there's a particular wet spot that you see, you probably want to get that tested and have a remediation company to come in and then fix that issue. If you actually had a leaking issue within the basement or the ceiling, if you don't take care of that right away and dry it out, within 24 to 48 hours, mold can grow exponentially. So you need to look at these things in a very serious manner. Just because you have a little mildew on a wall doesn't mean it's nothing. You need to get that checked out very well. I had a client call yesterday. She is dealing with chronic yeast infections to a point that she had seborrheic dermatitis in the scalp, as well as a fungal infection on her feet that she couldn't get rid of for many, many years. And every time she goes to the doctor is saying there's nothing wrong with it. And then even her questionnaire, she doesn't really talk about mold issues because that's something that I end up having to ask. And then she says, "Oh yeah, I had a little black spot in the bathroom, and the testing company came by and they said it's just dead mold. We don't have to do anything about it. Mold is mold. You got to get that remediated, right? And especially if there's a hidden mold issue that you're not even aware of, and that actually stays behind the wall, those mold particles are less than zero point 0.2 microns. You could actually bypass the wall and get out, and then you never have to inhale it. So you do have to hire a right remediation company as well as a right testing company to look at moisture issues, looking at the HVAC, how that is, and then air quality is up to par. Is there any other sediments of the mold itself in the house? Mold count as well as mycotoxin levels has to be checked as well. It's not a simple thing that just because you have a little black dot on the circle on a wall, that you could just easily get that taken care of. You have to look at these things in a bigger fashion, especially if you have severe histamine response and food allergy issues, and then all these autoimmune conditions that you cannot get rid of, and you don't know how to fix it. Then that's the best way. You need to really look at these things as well.
How did you change your life holistically, and how did you use functional medicine to take measures to continue to recover after the heart attack? How did that change your life in terms of the awareness piece and the preventative measures?
Prevention measures has been really looked at not only helping to change the infections that I actually had, but looking at the cellular health and how that gets affected because of the toxicity and the microbiome changes that are occurring.
Mm.
So those are the things been very, very much of a eye-opening moment for me. But now is more looking at how do we change our environment to light exposure and how to support that, as well as EMF exposure, along with circadian rhythm changes and nervous system dysfunction has been like the core thing that I'm having to implement for patients as a foundational aspect that's been helping a lot, especially for mast cell issues that been very hard to control, but now they're able to.
And what is the typical patient journey in terms of what are the typical signs and symptoms or disease that patient come to see you for?
That could be broad of dealing with the gut issues. They could be dealing with high issue dealing with histamine or allergies or food sensitivity. I'm now seeing a lot of clients dealing with mast cell issues, especially after COVID or COVID-19 injection, which end up having to trigger a lot of immune dysfunction that occurs on some people. Autoimmune disorders are a big one, such as Hashimoto's, or they end up having to have deal with psoriasis or eczema problem because the changes of the barrier of the skin and as well as a change in the function of the organ in itself there is a possible root cause issue to doing that. It just didn't occur because of a genetic issue, right? Genetic could be one thing, but the environment, the cell membrane, the microbiome, all these things are a triggering point to release some of the issues that you might be seeing. As well as I'm seeing patients dealing with long COVID issues as well. That really helped to open up the general medicine world or the centralized medicine world to see that viruses can cause long-term health consequences afterwards, right? So in the functional medicine world, looking at Lyme disease or even viral infections or even dealing with mold toxicity, we knew from the get-go that all these microbiome challenges can lead into chronic fatigue issues, as well as multiple other health consequences can be long-term and can be debilitating for the patients. So these are the type of clients that I see these days. When I first started out in doing functional medicine, I'm a licensed pharmacist as well as trained as a compounding pharmacy. So especially in Europe, it may not be a bigger market compared to the United States, but my overall traditional training was working in the pharmaceutical lab and formulating drugs for patients' needs. So especially if the patient is allergic to certain dyes or chemicals, or they may not be able to take the medication orally, we're able to make the medication to a transdermal delivery on medication. So you could simply just apply in a wrist and get the medication absorbed that way.
Mhm.
I was lucky enough to get exposed to holistic medicine since I was a child because my grandparents were really into holistic medicine as well as more of a natural living ways into eating healthy, going to the hike on a weekly basis to move, getting fresh spring water up in the mountains, as well as waking up correctly, getting the right sun exposure, right? Family structure, all these things were ingrained in me when I was little. I really didn't like it, enjoyed it, but I'm looking back. What a fortunate thing that I was exposed to, and that it became a focal point as a foundation for me to dive into this side of holistic and functional medicine. That I look at patient care very holistically in a comprehensive way, and looking at that four-dimensional approach to helping them heal.
What are some of the most negative lifestyle habits that you come across from your patients that you notice that may contribute to a decline in health and may actually lead them to suffer from some of the chronic conditions that you see them for?
There's so many these days, right? Because our overall environment is very toxic. But the biggest thing that I see within the United States, even when I was in UK last year and looking at the general diet out there as well, nothing far different than the United States, is the poor processed food that are available within the market, right? That end up having to be subsidized, and you actually have bad food being cheap, and then general population end up having to buy those because that's a quick fix or it's cheaper for them to afford, and that becomes a really a driven point affecting the changes in the microbiome and then changing the way that our body's able to detox as well as the function as well. So that's the number one thing that I see is just a poor diet in itself, right? We don't have an overall know-how how to cook or how to get the right food and such, even though the information might be available. I think it's more generational aspect that we are not taught properly. Because when I was growing up, my grandparents ended up having to, grow. They had a small field that ended up having to, grow their own food, for instance, right? So that's something that I really pictured and thinking that's the right thing to do. But especially for industrialized nations like United States and UK, that's very far fetched. So that's number one. Number two, the the other issue is the environmental toxins, right? So glyphosates, for instance, PFAS, forever chemicals, or BPA, like bisphenols, end up having to be the endocrine disruptors, which also affecting multiple issues dealing with your hormones, your gut health, your nervous system being dysfunctioned, as well as your cell membrane being affected as well. So that's why when I look at the holistic side of it, that it is that four-step approach and looking at that person. And the third thing is another environmental issue, artificial lights or toxic lights like blue lights, as well as EMF exposure,
Mm,
right?
mm,
EMF especially can actually cause more disturbances with the microbiome. Especially, they have some studies looking at how EMF exposure allows mold to thrive within the body and grow even more and causing the chronic issues you're dealing with. EMF can also disrupt viral particles as well, which can be linking to certain cancers at the same time. So EMF is a big one, right? We're so into technology these days, especially our cell phones, Bluetooth headsets, our computer everywhere, including 5G, or certain countries have 6G towers everywhere as well, and Wi-Fi. All those are end up having to be impacting on our nervous system, our microbiome, our cell health. That all those three things are the biggest impact that I see when I see clients, and then those are top things I end up having to ask first. And then the deep side is, how was your family structure? Any trauma issues you dealt with? So going into nervous system dysfunction, that side of it as well.
Thank you. That's really good to hear them in this category. I was wondering if we could take a deeper dive into the toxins specifically, because very often when we talk about toxins or mold, we can get under the impression that we don't have mold in our house, or we think we don't, or we don't consume a lot of toxin. But my observation with my clients is that, and myself, is that we consume a lot more toxins that we think we do. Could you maybe give us some details as to the day-to-day consumerism of toxin and how much we consume and what they are, what they do to us, and how we can avoid some of them?
Oh wow, that's a loaded question actually, right? So let's look at food for instance. Like if you, certain countries end up having to ban some of the ingredients, but especially for United States, that containing sodium benzoates as a preservative, for instance, right? Or certain things like methylparabens in the food, or brominated sweeteners. Right? Those are all toxins, can cause endocrine disruptor and gut microbiome issues as well. So when you are waking up in the morning, end up having to reach a cereal, and that particular cereal containing all those type of ingredients, right, plus sugar, now you just end up having to really disrupt that particular person to basically fail throughout the day. So that's probably the number one thing that you end up having to be getting into. The second thing is probably your skincare products. So things that you end up having to wash your hair, your skin, as well as things to apply on your skin, like lotion or cream, that also contains some of those endocrine disruptors or certain chemicals that can also affect the barrier of the skin, right? As well as the microbiome changes in the skin itself is as well. And then your skin being the largest organ, it is an organ, end up having to absorb those the chemicals into your body and to your cells. So there are studies available that actually looks at the DNA adduct. What DNA adduct is a embedding of these chemicals within to the DNA structure itself. So it's a company called IGL in Germany. They do a blood test to see the type of these toxins getting embedded into the cells, and you're able to see that things like triclosan, I don't know if it's available in UK or Europe or not, but triclosan has been used in US in toothpaste as well as antimicrobial soaps. And that's basically it. It's a anti-gingivitis antimicrobial product that can be a very much of a liver toxic substance that you keep on having to put into your mouth as well as being absorbed in the skin. And we see that triclosan gets embedded into the cell membrane. So can mold toxins, heavy metals such as lead, mercury, and then you have aluminum, right? So especially when you're at home and you are wrapping your food of aluminum, those aluminum can actually leach into your food. Aluminum has been shown to cause Alzheimer's and causing neuroinflammation. Aluminum can also cause DNA changes as well, and that could also lead into potential cancer or other structural damages that goes on within the cell itself, that you have to look at these very carefully and try to minimize the toxic exposure throughout the day, or even just a period of time than when you are potentially going through treatment as well. Because if you keep on having to have accumulation, I put this analogy as like a bucket, for instance. If your bucket is completely full of heavy metals, chemicals, PFAS, glyphosates, mold, viruses, and all these different things that come into play, that bucket end up having to overflow. And then the issue is that it can lead into the functional changes within the body, leading into gut issues, hormonal dysfunction, right? Nervous system being dysregulated, such as anxiety, right? Mental health issues that patient might be dealing with, and then as well as autoimmune disorders, other inflammatory conditions, right? ALS, Parkinson's, Alzheimer's. Those are all signs of a result that stems from these toxicity.
So, what if we were to get on a mission to clean up our house a little bit? Let's go room by room. What would be the primary suspects in our kitchens? What are the things that would be highly toxic that we could simply through education or reading the ingredient or looking at the boxes just clear out from our kitchen to have a less toxic kitchen environment?
Not even just kitchen, the first thing is, how is your air quality in your house? I think that's
That's
probably the first
great.
thing that I would look at. So if you
Yeah.
have any air fresheners, I would toss it out ASAP. Those are endocrine disruptors, but also it can cause disruption within your cell membrane, and can be very neurotoxic as well, right? So one time I got, I mean, several times actually, I get into an Uber, and then I understand that your Uber vehicle has to be very clean, but they also put these artificial um, scents in the car, and then that really causes me to be reacting, or in certain cases having a lot of headaches while in the car, and it's not very pleasant, right? So those are the first thing that you need to get rid of. Any air fresheners you could get rid of.
What did you do?
Any,
Did you ask them to open the windows or to get rid of
I
it?
do, but it's
Yeah.
very difficult to do that because the last thing you want to do is have a negative rating on your Uber score.
I think
So
the next step forward is to have a rating so that you can choose the taxi driver that doesn't use sense
yeah,
in there.
but it's everywhere, right? So that's the
Right.
thing. And then when you are using anything like cleansers or any antimicrobial solutions that you buy, right? They end up having to put in some of these chemicals as well, the forever chemicals, or uh, certain things that containing parabens. And some of these antimicrobials are not even just toxic to the microbials that you're trying to kill, they're so bad for us as well, right? So there's an accumulation of these toxins getting involved. And so if you don't aerate your house very well, or you keep on having to use these substances, and another thing that I don't like is air fresheners in the bathroom. Like when you have obviously you have to do your duties, right? So utilizing these sprays to neutralize the smell doesn't really work well. You could use essential oils to neutralize the smell as well. Vinegar does very well into, if you be mixing certain essential oils, can neutralize that. And so if I want to give you a better option for cleansing, I would recommend more vinegar, white vinegar, plus essential oils like lemon, for instance, can be very good to cut through grease. You could even get some lemon rinds or orange rinds and then put into vinegar for about a week or two, and then the essential oils or the terpenes from the citrus rinds can actually leach out, and you could use that to clean your entire house as well. It's very safe for your furnitures, and it's cheap, and it's less toxic. So that's another thing you could do, right? Certain things like hydrogen peroxide could be used to clean certain surfaces, but you got to be careful not to bleach material or upholstery. So that's one thing. But there are so many ways to do that. And then when you're looking at the kitchen side, like dish detergent, certain dish detergent has harmful surfactants, which can be um, a residue on a dish itself. So if you're having to eat something off of those particular dish, those residues or those surfactants go into your gut and then causes leaky gut. So all the things like dishwasher detergents are very powerful, right? It doesn't do any scrubbing, but what it do, those chemicals, those surfactants are so powerful that it removes the grease in the dishwasher, but those residues end up having to be embedded in the material and you end up having to swallow it. So make sure you get the cleanest possible dishwasher, or if you could avoid it, great. But nowadays with the modern living, it's very difficult to do. So you have to really pick and choose if what is the less of a two evil, basically.
Yes. One thing that I'm so mindful of in my kitchen and when I cook is plastic boxes or plastic containers. I really avoid them and I use glass wherever I can. Can you tell us a little bit more about that and how important it is to be a bit more mindful, or even just carrying your coffee in a plastic cup all day or carrying your water bottle? Can you tell us about that?
Yeah, very interesting. I'm going to do a post on those disposable cups. You think about disposable paper cups, you know that the hot beverage is going to be staying in the cup itself, but what's lined inside the cup itself? It's plastic. Right? So all those plastic end up having to be leached and you're swallowing it. As well as when you're drinking those, it could be some sparkling water in a can. Those cans are sometimes lined with BPA as well, bisphenols, which are endocrine disrupting, gut microbiome disturbing as well. It can cause leaky gut. So these are things that are being leached out of the food. So if you think about like the plastic containers, for instance, if you get doing takeout and or if you have Tupperwares at home that are made of plastic, I'll recommend either minimize it or try to get rid of it as quick as you can because it's more harmful than good. So
Mm.
for the foundational things that I talk about with clients, the first thing is clean out your pantry. Not even just get rid of the harmful seed oils, but I'll recommend getting rid of the plastic containers or even get rid of aluminum foil much as you can so you don't use it,
Hmm.
and then use naturally occurring or at least less toxic parchment paper to cook. Or there are certain other things like I'm not a big fan of silicone, but there are silicone Tupperware covers that you could use as well. But generally, you want to stick with glass is the best way to do it. That's neutral, is acid resistant, heat resistant, so it's very clean and is also easy to clean and keep track of in the house.
Earlier on, you made a reference to forever chemicals, and I know that it's now a growing concern, especially in the skincare and makeup and personal hygiene industry. Can you tell us more about that and maybe educate us a little bit about the things that we do when we take a shower and when we do our skincare ritual that could actually be doing more harm than good and we may not be aware of?
So forever chemicals, usually I'm really bad at saying this out loud. Polyfluoroalkyl substances, or PFAS, basically, that are known to be the forever chemicals, and these are a group of synthetic chemicals that are resistant to heat, oil, water, or grease. So, and these are been going on since the 1940s. And usually, when you're looking at like non-stick cookwares or fast food box linings, stain resistant or water resistant fabrics, like I don't know if you have any camping gear that contains Gore-Tex, right? That's
Mhm.
made by DuPont, and those contain PFAS, right? And I used to wear those garments all the time when I was in Scouts because I used to camp a lot and hike, and those tends to be a forever chemical that's already lined into the garment itself, so it's not very good. And then when you talk about like cleaning certain cleaning products or paints, also cause that issue, and the the effects of the PFAS exposure can lead into possibly cancer, causing high cholesterol, thyroid disease, liver damages, certainly histamine response, including asthma, allergies, also lowering of the immune system as well. So there's been some cases where the decrease in fertility, there's been case of newborn death, low birth weight, birth defects, and developmental issues as well. But the issue is that these are chemicals everywhere. And then in lieu of that, the entire environment has been contaminated with these things within the air, water, and the soil that it's very difficult to get rid of. And these end up having to be embedded in the cell membrane. So you do see this results in the DNA adduct testing I mentioned before. but there's certain ways to allow to prevent or at least to reversing the DNA adduct by working to achieve that cellular detox we're looking for. So use of phospholipid therapy or at least a membrane stimulation therapy, some of the things that I utilize to help reverse these damages. There's a whole topic now with microplastics as well, right? They're now seeing microplastics in sperm, right? Out of all places. How is that even possible? Because we're breathing it in, we're also ingesting it, but those plastics are lipophilic, can also leach into your skin. So those are things that end up having to be the case. How do we get rid of those things? And there are studies right now looking at these things, but one of the things that could be very powerful and possibly able to reverse these things is by utilizing phospholipids. These are fatty acids to help reversing DNA adduct and act as a chemical chaperones to uncleave these toxins out of the cell membrane and then taking it away and allow proper management of the toxicity within the body itself. So you need to support your liver, but you also have to support your cell and your mitochondria. And then the reversing the epigenetic changes that went on because of these toxin exposures.
So, what would that look like in a practical sense? What would someone have to do a little bit of a detox and reverse some of the damage caused by a toxic environment?
Sure. So use of binders are not the first thing that I end up having to recommend doing. So, binders like charcoal, bentonite clay. I'm not a big fan of bentonite clay because bentonite clay, even though it's a natural binding substance, it does contain heavy metals because from the natural substance that's naturally occurring. So I'm not a big fan of it. It's also been contaminated with different naturally occurring chemicals that can be toxic as well. So I'm not a fan of that. But the first thing that I look at is how is that person's cell membrane health is occurring is the biggest thing that you have to really question, right? So when you look at the cell in itself, the cell actually has different membranes. So if you look at, remember biology back in the day, there's a bilayer structure of the cell, and then the outer structure is made of something called phospholipids, right? Which is more water-liking, right? And then you actually have a lipophilic substance or the inside of the cell, if you want to explain very in a simple term, that contains linoleic or alpha linoleic to help to support that structure. So why this is so important is that during an early stage of cell danger response, and there's a coin that's termed by Dr. Robert Navio out of UC Davis, is an MD, PhD. He really revolutionized and then theorizing the metabolomic changes that goes on in the cell in itself because of these toxins or viruses or certain other substance that's causing this. It explains in heavily that your cells end up having to be damaged because of these stressors or the chemicals getting exposed to. And how it happens is that your cells are not able to communicate properly to help to re-establish that communication and allow proper management of the cell functioning. You need to supplement it, or at least to help to replenish the lack of the fatty acids, the healthy fatty acids, to really restructure it. But the last thing that you want to really, and then following by helping to allow proper removal of these toxins out of the cells. And so some of these phospholipids, like I love using Body Bio PC, Body Bio's balanced oil, so as well as sodium butyrate. These all three things act as a chemical chaperone to remove these toxins off the cells to allow proper management of the mitochondria to function properly, to allow proper direction of the healing cycle that we are looking for. So, if you want to just get a gist of what that looks like, usually I'd recommend to start with Body Bio's PC, balanced oil, and then sodium butyrate. Right, butyric acid is a very powerful ways, and not even just for supporting the gut, but also helps to fix this the DNA damage and proper formation of amino acid in that sense of it. And then there's something called the TUDCA, which is basically a biosalt to help take away those chemicals, but also helps to restructure the protein misfolding that occurs from the actual damage in itself. So there's a fourfold aspect in terms of utilize these different things, right? PC, a balance oil, which actually contains omega-6, omega-3 to replace the linoleic uh, aspect there to help to restructure it. And then the third is the sodium butyrate actually act as a chemical chaperone. And TUDCA helps to unfold the misfolding within the cells. And then the PC not only help to restructure the cell membrane, act to sweeping the toxins away from the cell. So this way, the macrophages and different immune cells are able to come in and then chomp that up and then take it away. So you need to support the cellular health first. Like I said, that's the most important part we need to help with, even starting out, rather than just giving patients binders or just liver support and just call it a day.
Mm. And I'm really interested in Tatka, particularly because I know it's been used in traditional Chinese medicine for centuries and it's coming back now into the conversation. I was wondering if someone was to embark on that journey of detoxification, is it something that they would take into in cycles? Is it something that they would take all the time? Is it something that they would take once to do a full detox and then cycle out of it? What would be your recommendations around that?
Can you get Tutka in UK? I wasn't sure if it was available because last year when I was in UK, Tutka was not available for to be sold as a supplement. Is that still true
It's
or no?
available in France. I know you
Oh,
can
it's
get
in
it in
France.
France.
Okay.
Yeah.
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 So Tutka has been used in Chinese medicine for a long period of time. So back in the day, they used to get these bile salts from bears. So it's not bear. It's not come from a bear or any animals. This is all synthetically derived, but naturally occurring bile salt. Uh, and that has been found in both humans and animals, and it actually has a very well known to help with inflammation. And Tutka also aids in a variety of other medical conditions, including cystic fibrosis, congestion due to liver cirrhosis, high cholesterol levels, and even certain cases, I'm not supposed to say it out loud, but there's been linked to utilizing Tutka for cancer treatments, right?
Mm,
And there
mm,
are now treatments utilizing, especially US, there's a particular ALS drug that combines Tutka and sodium phenylbutyrate to help reverse neurological damage that went on and resulting in ALS. So there's a
mm.
very wide range of how TUDCA can be utilized. And not only that, it actually helps to protect the liver from toxic substances such as alcohol. And so if you are planning on having a little bit of drink, I would recommend taking TUDCA.
Or milk thistle?
Or
Do you like milk? Yeah.
I would recommend both, actually. I recommend both.
Just do
Yeah.
a cocktail. Do a free cocktail.
Exactly. So yesterday I was at an event and then they were giving out cocktails, so I ended up having to take Tutka as well as milk thistle and glutathione beforehand, so I don't have a
Yes.
issue with my potential hangover. So that's been really helpful. But yeah, so this has been really helpful with doing these things, and the potential health benefit, especially for Tutka, is that it also helps with digestion and bowel movement. I mentioned about the liver protection, also helps to maintain a healthy blood pressure levels and improve the cognitive function. So when you have a history of, let's just say, traumatic brain injury, some of the protocol has been utilizing Tutka into the mixture to help as a neuro protective, but also helps to decrease neural inflammation. Right? So there's a wide variety of use of how Tutka can be. So it's not just about fat absorption or digestion support. There's multiple ways that Tutka can be very helpful. So I do recommend to be adding in as an arsenal for yourself to be taken on a daily basis. So for me, I do take it about 500 milligrams twice a day. That's just me. That's what what I do. And certain patients who are dealing with some of the toxicity issues, they may end up having to take more. Um, so that's the way that I end up having to support the client.
Mm. And I wonder if somebody is curious and listening and thinking, I don't know where I'm at in my toxicity journey. I don't know how toxic my environment is, or I don't know actually where I'm at on the spectrum. Can someone get a sense? Is there any biomarkers that would indicate where we're at? Is there any test? How would we educate ourselves, but also get a sense for what's going on inside ourselves to get a clearer picture as to how toxic we might have become?
That's another loaded question, but generally, I say is if you're dealing with any issue, dealing with mental fog, um, brain fog, such as difficulty focusing, maybe you actually have some type of pain issues. Maybe there's an intolerance to heat, low body temperature, low energy, muscle tonicity is being lost. You're constantly having to deal with some type of infection you cannot clear out, right? Poor gut digestion. Maybe you're sensitive to EMF, right? Maybe you're next to your Wi-Fi or your cell phone, and then you're constantly getting headaches, or you feel like your body's vibrating because of these things,
Mm-hmm.
including poor gut health, and then skin issues, any type of inflammation. That's a sign of a toxicity. So
Yeah.
that's the reason why when I say a loaded question, a lot of these stemming issues that patients might be dealing with could be related to the toxicity, and as well as the toxicity causing nutrient deficiencies, as well as microbiome or gut changes that occurs.
Mm-hmm. Mm-hmm. And could you tell us a little bit more about practical steps to limit our EMF exposure while living a modern life? And I know this might be a loaded question too, but of course, we love our digital devices, we love our Wi-Fi. I'm grateful to Wi-Fi right now. That's how I can do this interview with you. But there is a lot to be said about, heightened anxiety, headaches, and Bluetooth. And perhaps can we start by explaining what EMF does to our bodies, and look into practical ways to continue to live in a modern life, but to minimize the exposure?
Yeah, I forgot to mention at the last question that patients could actually test themselves as well, not just a symptom wise, but for testing purposes, there are urine total tox testing that you could do. So there's certain countries that may not be able to access that, but in US, I do recommend Vibrant Wellness as one of the companies that I work with in terms of ordering these labs. A simple urine testing to looking at um, some of the forever chemicals such as PFAS, such as certain things like glyphosates, bisphenols, but specifically mold toxins and heavy metals, and looking at these things and see what type of issues you might be dealing with. Unfortunately, that particular testing only looks at what you're excreting out. What does that mean? Let's just say if you're dealing with chronic issues with these toxicity, you're not able to easily release these things out of your fat or your cell membrane. As a result, the result might be showing a low levels of it, and so certain practitioners are like, oh, you're not dealing with any other toxicity. But then after you're doing some type of detox protocol, those type of cell membrane support that I mentioned before, those levels of chemicals end up having to be shown higher in the urine later on, because now you're allowing the body to detox correctly and allowing proper management, or at least the flow of the toxicity out of the body itself. So, first thing that we need to look at is how you're feeling, how your environment is to minimize the toxic exposure, such as getting rid of the harmful cookwares or plastics, and then your cleansing materials that you actually use in the house, including air quality to be right. And then if the symptoms don't change and you notice that it's still getting worse, you probably want to work with a functional medicine provider who's able to run these particular tests to see or analyze what type of a toxicity you're dealing with, and to help you get to the root of the issue and then get to the ultimate healing.
Mm.
So that's the part that I forgot to mention.
Ah,
But in looking at EMF, how to minimize that? Well, it's your environment, right? So first thing that you could do easily is to turn off your Wi-Fi at night. So what I have in my house, I have a small timer that's connected to the Wi-Fi router. So around 11 p.m., that's when the Wi-Fi router turns off. And then around 7 a.m., the Wi-Fi turns on. So this way the overexposure is less. On the challenging part is that I live in a condo. So even though I might be doing everything I can to protect myself, my neighbors that are top of me, side of me, as well as below me are not doing that. So that could be a problem as well. So one thing that I like to recommend some patients who have very severe EMF sensitivity, you could buy these Faraday tents. that could cover your entire body also below your bed. So this way, the exposure of the EMF, including Wi-Fi signals, 4G or 5G signals, and then certain radio signals are prevented from coming in. That actually helps to reduce that. So I have patients who have severe mast cell activation issues. They're super sensitive to EMF, that nothing worked until they start to incorporate these things into their life. Another thing they could do, and some patients may not, some practitioners may not end up having to agree with this, I do like a grounding mattress cover. So
Mm-hmm.
this way you are grounded throughout the night, and that also prevents EMF to be affecting you cellularly and while you're sleeping. And I do get a better sleep on that compared to any other mattress covers I've used before. So that's another thing that you could do. And then third is to turn off your cell phone when you sleep, not just put it in airplane mode. If you put your phone in airplane mode, it's still transmitting data, right? So you want to turn your cell phone off completely. And so if you want to buy like a Faraday bag that you could put your phone in, that's another way to do it. But if you don't want to spend the money on it, just turn off your cell phone.
Mm-hmm.
Okay.
And then
And
buy an old school alarm.
yes, that would be the next part. And I would also recommend not putting your cell phone near your pelvic area, right? Or what what guys do is they put it right on their butt with their back pocket. So that's not a good thing that you want to do. You want to keep that phone away from you as far as you can. And then when you're talking, please do not put your phone next to your head. That's the last thing you want to do. And you don't want to use any Bluetooth device either. And that becomes difficult too, right? Because we've been so in tuned into all these technology available, especially when you get into a car. Nowadays, all cars have Bluetooth on, and those have to be as minimized as you can. There are certain EMF blocking technology you could wear. I like wearing these Lila quantum beads that has been shown to block EMF as well as to help increase and help to minimize the frequency changes in the body. There are other electronic materials out there. There's another company that sells something called the EMF rock. So it actually helps to neutralize EMF based on the earth core technology that nature already gives us. So that's a way to do it. But there's many ways to do so. But if you can, ground yourself as much as you can outside. So when you wake up, you want to get the right sun exposure is one. But if you have a big lawn or if you go to a park, get yourself grounded for about 10 to 15 minutes, walk barefooted. That's another powerful way to do so. There are grounding sneakers. I don't know how good those are.
Yeah, they're awesome. I'm the funny person with grounding shoes all the time.
Yeah, that I found one last year when I was at Health Optimization Summit, and I'm not going to mention any names, but they
Yeah,
did give
they're
me a
good.
pair. They give me a pair of sneakers. I don't know how good they are or how long they last and such. And then so if you could find that to be useful, go right ahead. I mean that's the best way. You have to find out what is working out for you. But this is a general recommendation I give to my clients.
And I think also a general awareness piece around being more in tune with your body's reaction. For example, I am a runner, and for years before I educated myself around EMFs, I use Bluetooth. I won't mention the name, but I'm sure everybody can guess. And I love them. They're really convenient. I even used them when I was doing calls, etc. But I did notice that after listening to music or a podcast for a couple of hours, I would have this banging headache, like really bad migraine. And my hydration was on point, my nutrition was on point. And it turns out the minute I put those Bluetooth devices out of my reach, out of my house, out of my life, the headaches were gone.
Yeah, I mean, I about a year ago actually, I was last year. I unfortunately ruptured my Achilles, and so you trying to use my crutch to move around. It was very difficult for me to handle everything, especially when you have a wire device like this. You could end up having to trip or doing some other getting into some other accident. So I ended up having to use a Bluetooth device for a short period of time. And even wearing after about 20-30 minutes, the the pulsing sensation that goes on in my ear was very, very unbearable. So now I know like how much of a damaging it is. Not wearing it and then wearing it back again was not something that I would recommend, even doing for myself or anyone else now.
You become more sensitive to it, I think. Once
Very
you've
sensitive.
experienced life without, if you put those in, you feel it. Like exactly what you said, that pulse sensation. I think that's a spot on description. I'm very sensitive to that too.
Yeah. And then when you are getting more in tune with your body, you get to feel that there's something off with you. Now, I'm not trying to be making you like a complete hypochondriac, but you get to see that your body's completely out of tune, right? Your nervous system is being out of tune as well, or in a dysfunctional state. When you're able to recognize that, that's a powerful thing. Self realization is a big thing. And then you're able to ground yourself back, right? Able to make swift changes, getting yourself improved, back in line, and to really conquer your day. And that's something that we forget to do that because we're so busy living our life these days, working, taking care of family, and then also we're getting inundated with different informations on the internet, social media, right? And then all the chemicals getting involved in the body, which is also disconnecting us from our own body, our own soul, and our own nature within the environment, that we forget to recognize that there is a problem within us. But once you're able to recognize that, that's a powerful thing. Now able to recognize and shift and change and get yourself better.
Thank you so much, Dr. Kim. I've learned so much, and I'm really grateful for all your insights and advice. Is there one last piece of practical measure you would like to give our audience, something you wish you knew to protect your health, but you didn't, and you know now that you could share with us
Yeah,
around?
absolutely.
Mhm.
You are your own best doctor. You have to be your own advocate. No one's going to come and save you. You have to protect yourself. You have to eat well. You have to exercise. You have to move. You have to manage your own health rather than trying to depend on the overall system or the centralized medicine that we have right now.
Thank you. What would be the best way to connect to your world?
Absolutely. I have a website, drkimwellness.com. I have a social media. Very active on Instagram is dr.john.farmd. I'm also going to offer your listeners ways to work with me. And so I have a special link that I'll be sending over to you. And hopefully you can share with your listeners. So if you need additional information about cellular health and detox and then potentially work with me, that will be offered to your listeners at a very low price, as well as to keep on having to have this dialogue.
Wonderful. We really appreciate that, and we
Yeah.
appreciate all your knowledge. Thank you.
Thank you. I appreciate it.
Thank you for spending your time with me today and listening to this episode. Remember to subscribe so that you can receive weekly updates. And if today's message resonated with you, please remember to share it with a friend, a colleague, or a loved one who could really benefit from this episode.